Welcome to the Nursing Ministry channel. For our new viewers, I welcome you. For our returning viewers, thank you, and thank you again, and you are welcome too. My name is Ludia Osita, and I am a registered nurse for the new viewers. And I welcome you to this platform where we discuss all matters nursing as a ministry and as a profession. In case you feel lost in our discussion today, kindly watch our previous episodes. It will give you a clear understanding of what our topic of discussion is today. Now, we have been discussing about this person that is interested in nursing and has qualified and joined the nursing institution. And now they're taking their courses in nursing. So I am introducing the various courses that the nursing student should expect to encounter. Now, we talked about anatomy and physiology. We have gone through the nursing fundamentals. We looked at the trends in nursing, ethics and etiquette part 1 in our previous episode. So in this episode, we are going to look at the second part, and specifically the professional etiquette of nursing. Now, having gone through 6 code of ethics that the nurses have to adhere to, I'm going to try and balance it and introduce 6 etiquettes, professional nursing etiquettes, just to create a balance. Now, you may wonder, what is etiquette? Etiquette is the behaviors, the attitude, the values that guide a nurse's action to do what they do. Once again, etiquette is the behaviors, the attitudes, and the values that guides a nurse's actions. Now, please remember, ethics was more about their moral behavior. It's something they do in the private, in the public. It is long term, it is lifelong. But with etiquette, it is more situational. Because we're going to look at why it is situational, because it's going to change depending on their setting or whom they encounter, and we're going to look at the reasons why. So now, to create a balance, like I've said, we're going to look at 6 etiquettes. The first one you're going to look at is adherence to the ethics and professional standards. The second one, we look at professional appearance. The third, we're going to look at cultural sensitivity. The fourth one, we're going to look at courtesy and respect. Then the fifth, effective communication. And we will wrap it up looking at the social media etiquette. Now, these are not the only etiquettes, but they are the main ones that are going to guide a nurse in their interactions with others in the workplace. Now, when I say others, I mean the patient, the patient's family, and their other healthcare personnel or workers or their colleagues. So what is it that they should do or not do in their interactions with the patients and the families of this patient and their colleagues? That is what you're going to look at. Now, starting off, keeping in mind nursing is a ministry, we're going to look at the first one, that is the professional adherence to the ethics and professional standards. If you remember well, the ethics we discussed last week, for instance, autonomy, veracity, fidelity, beneficence, non-maleficence, all these were ethics. Now, the nurse in their etiquette are required to adhere to those ethics. Because once they adhere to it, then they are fulfilling the part of observing the professional nursing etiquette. So that is the first part, adhering. Then secondly, the professional standards that they are adhering to have to do with matters, for instance, confidentiality and privacy of the patient. Now, sometimes those terms are interchangeable, confidentiality, privacy, but there's a bit of a difference. When we talk of confidentiality, it means protecting the patient's information from going to those who have no business in the care of the patient. whether it is about protecting their diagnosis, what is it they're suffering from, what state they are in at that time, ensuring that no one looks at their file who is not caring for them, not disclosing their personal information to, for instance, family members who are not the next of kin, or the patient has stated clearly whom they want the information to be shared with or not shared with. So that is more of confidentiality. It is protecting that information about the patient. Now, privacy, it is more about controlling who or what or when activities or care is given to the patient. So you're controlling, for instance, whenever you're caring for the patient as a nurse, you're controlling, for instance, putting on the net, what do you call it? The cover around the patient before caring for them. You're controlling other people from, seeing them undignified, or even their personal information. You're controlling who gets access to it. So that is more about privacy. Confidentiality and privacy, they are all about adhering to the profession. It's all about the professional standard. Then secondly, we have matters of distinguishing the boundary between professional and unprofessional behavior. Creating a distinction, what behavior is this that is professional and this one that has overstepped that boundary. Now, let's give an instance about a patient who is a nurse who enters a patient's room, and there is the personal space between the nurse and the patient. So should the patient maybe feel as if they are falling and they stretch out their hand to grab onto the nurse, maybe their uniform. And another scenario is whereby they are not falling, but they still go ahead and touch the nurse. They've both touched the nurse. One was afraid of falling and grabbed the nurse, and the other one who simply went and touched the nurse. Now, professional standard means you should be able to distinguish whether that was a boundary that has been overstepped or it is still professional, it was just part of the care, the patient was afraid. So that we don't have cases about sexual assault or the patient was being touchy inappropriately and all that. So maintaining that professional standards means you as the nurse, you should be able to distinguish. Because if you cannot distinguish, you may end up going off or accusing a patient wrongfully whilst they were grabbing onto you because of fear of falling, or they felt uncomfortable, or there was a procedure being done that was uncomfortable and they grabbed on you. So you should be able to maintain that professional standard by distinguishing the barrier, the boundary between what is professional and what is not professional. So other than confidentiality and privacy and being able to distinguish that boundary, remember we are trying to uphold to adhere to the ethics and professional standards, right? Then another third part of this is being punctual. It's part of these professional standards. Being on time. I always joke that this punctuality really refers to when you're showing up at work. Because you're required to show up on time, but the time you will leave, really, you do not know. Sometimes the shift can extend 30 minutes, 1 hour, 3 hours, because you have things to do. So punctuality really refers to showing up on time for the meetings, for work on your everyday basis. And so that is also part of professional standards. Ladies and gentlemen, let's look a little bit at the second one, and that is professional appearance. You as a nurse, I'm talking to you, the student who is in college, this is what you will be taught. That when you become a nurse, or when you go to the wards as a nursing student, there is a professional appearance that you should uphold from the crown of your head to the sole of your foot. So it starts from how you hold your hair. You should have your hair all over. Even if you've made your hair, there's a way you hold it so that it doesn't go all over your face. It does not go into the patient's food, the medications, the hair, the way you style your hair, holding it in such a way that it is professional. It doesn't get on the way of on the patient or even distracting the work you're doing. Secondly, even how you, for the ladies, no excessive makeup. You can wear makeup, but no excessive makeup. Then the jewelry that you put on, no excessive jewelry. Same for the gentlemen, you have to watch your hair. The hair should be neat. So rarely do we see men with dreadlocks as nurses. Most of them have shaved it. But should there be any such case, there's a way to hold your hair and keep it clean and neat. So for the men, it is about keeping the hair short and neat. And then for the no excessive jewelry also. And for the ladies, the hair, like I've explained how to hold it, no excessive makeup and jewelry. Then the uniform should be neat at all times. And then also the length of the uniform, for instance, if they're wearing skirts, then the length should be below the knee, not above the knee. Because of all the bending and moving around, it should be comfortable, not too tight. And then now let me pause for the uniform. It is very advisable as a nurse to have an extra pair or two of your uniforms in the locker room. The reason being, there'll be a lot of fluids, there'll be a lot of instances whereby, for instance, the shift has extended longer than expected. Maybe somebody has called off, they're not able to come to work. Now, you cannot abandon the patient, so you may be required to stay in for an extra shift while they look for a replacement. And in case they don't get a replacement and you're in for the second shift, at least you have a uniform in your locker. If not locker room, you can have it in your car. So you may find most nurses traveling with a bag, and the bag has extra uniforms and all in the trunk of the car, so that in case they need to wear another uniform, they're able to remove the dirty one and then put on the clean one. So for the uniforms, keep it neat at all times. In case of a spill, you have another one on the standby. Now, some hospitals or healthcare facilities have the laundry area where they have the scrubs. Scrubs are those uniforms you see most nurses wearing. In case you don't have an extra uniform, then you can go to the laundry area and get a pair of scrubs. Put it on, finish the work, and then return it to the laundry. So just to let you know that at all times the nurse should be neat. So now there's no excuse that at times you may walk around with spills all over you, the uniform looks unkempt, and the excuse will be that you are working, it happened, and so you don't have any extra attire. No, there are options. Always keep an extra pair. And if it happened and it just so happened that you didn't have an extra one, then go to the facility laundry and get some scrubs. They're always available. So neat appearance, we're talking about professional appearance. We've spoken of the hair, the makeup for the ladies, the gentlemen also. Excessive jewelry is not allowed. The uniform, how it should look, it should be comfortable, not too big, not too tight, something that allows free movement. Then for the shoes, it's always advised that the nursing student, you have closed shoes. And the reason is there may be sharps that may fall and end up injuring your foot. So to avoid all these accidents or even sharp objects falling on your foot, closed shoes is always advisable. One that allows you to move if you need to run around. There won't be incidences whereby the shoes get in the way. So you have an idea about professional appearance. There should be a name tag that is clearly visible. They don't allow you putting your name tag at the bottom. hanging at the bottom. It should be somewhere whereby when the patient looks, when the family looks, or anyone looks at you, they're able to identify this is Ludia, Osita, and RN. So the name tag should always be in an area of your body where it is visible. And then you should have probably your pens, the nursing scissors and all that neatly placed on you. So when you appear professional. All right. Other than that, for the professional appearance, you're going to move on and look at the third one, and we're discussing being an effective communicator. Please understand we're talking about etiquette. Etiquette number 1, we've talked about adherence to the ethics and professional standards. Etiquette number 2, you should always have a professional appearance. Then etiquette number 3 is about being an effective communicator. It is an etiquette. Let me explain. You as a nurse or the nursing students, you're being taught that when you go to communicate with the patients or the family, you should use clear and concise language. You should be clear and concise in your communication. By this, I mean, don't speak too fast, don't speak too slow, don't raise your voice, don't, mumble the words. So you're communicating clearly. Concisely means there's a lot of information to communicate, but don't go on and on and on and on. You may lose the patient and they may not understand what you're saying. So being concise means you have all this information, but there's a way you can package it and deliver it to the patient, and they're still getting the relevant information they need pertaining to them. So for instance, the patient has a disease called celiac. Now with celiac, if they take protein, the protein is called gluten, their immunity destroys the small intestine. As long as they've taken that protein that is called gluten, they've taken it in as food, their body responds by attacking specifically their small intestine. Now, once the small intestine is damaged, any other food that comes in the body will not have somewhere to be absorbed because the food is absorbed in that small intestine that has already been damaged by the body's immune system. Now, for you as a nurse, when you're communicating with the patient, trying to explain to them about celiac disease, you may have the patient, maybe they are pediatric, maybe they are 16 years old, or it may be a patient who is an elderly, or you have another patient who is in high school or college. Now, you can't communicate in the same manner to the pediatric, to this one in college, and to the elderly in the same manner. So for clear and concise information, there's a way you will talk to the child and just give them a rough idea. For instance, they are 16 years old. You may tell them, please, when you go home, ensure that you don't take barley, rye, oats, and wheat. Specifically those 4 food groups: barley, rye, oats, and wheat. And the reason is it has the protein inside of them that when it gets into your body, it makes you sick. And when it makes you sick, you may realize that you're having diarrhea because that is the symptom of celiac disease. You have put all that information in explaining to this 16-year-old to avoid barley, rye, oats, or wheat. Why? Because when they take it, it's going to make them sick and they will have diarrhea. The information is clear and concise. So when they go home, they will know no barley, rye, oats, and wheat. Now, this is a pediatric, a 16-year-old. But now you're having a college student who is having celiac disease. You won't go ahead and tell it to them in that same manner. Their capacity is much higher. So you can go into further detail and explain that there's a protein called gluten. It is found in certain foods, especially barley, rye, oats and wheat. To help you understand, just remember BROW, the acronym BROW, BROW. Now, avoid those four because once you take this gluten into your body, it goes to your small intestine and the immune system reacts and destroys the small intestine as a reaction to you taking the gluten. And the symptoms you're going to have, amongst others, the classic one is diarrhea, but you may end up feeling tired, you may end up feeling this, you may end up feeling that. Now, this is a college student who is able to accommodate all this information. You can even go ahead and give them materials to study more about the celiac disease. You're seeing the difference. So being an effective communicator as part of etiquette means that you're able to communicate effectively to each and every client that you have depending on their age group and their capacity to understand. Then another part of being an effective communicator is avoiding informal language or using colloquial terms, using slang. So in the healthcare setting, we are not allowed to use language such as, for instance, instead of telling the patient, oh, you have asthma, now avoid strenuous activities because it may make you feel puffed out. Puffed out is an informal language. Instead, you should tell them you may feel out of breath. So that is a more formal term to use. You will feel out of breath, not you will feel puffed out. So as an effective communicator, we should avoid informal language. We should avoid using colloquial terms, things like as you're communicating to the patient, I'll think of a term, but just avoiding those informal language. Even in greeting, for instance, when you're greeting the patient, we're supposed to maybe not say hi. Don't just say hi. Hi, it is not a formal communication. We should be using terms like hello, good morning, good evening, good afternoon, good night. So just avoiding informal terms, colloquial terms, like I said, and slang languages. We're going to look at how this ties up to our next etiquette, point of etiquette, because it ties in so closely to effective communication. Now, the same applies to the colleagues or to other healthcare professionals. When we are communicating, you should listen to others and respond appropriately. Listening to others and responding appropriately. So it's not just you talking, and when the patient wants to say something, you've gone, or you've shut them out, or you're not paying attention to what others are saying. So for instance, when giving medication to a patient, and as you have explained everything, the patient is okay with it, and you maybe break a vial and you are using the needle to pull out the medication. Then the patient states and says, nurse, how come this medication that you're giving me in this bag of, they may call it water, is yellow, but the one the nurse gave me yesterday was green? You see, the patient is communicating and saying, what you're giving me now is yellow in color, but the one I was given yesterday morning was green in color. You as a nurse, as an effective communicator, observing etiquette, you should listen to the patient and respond appropriately. So how will you respond appropriately? Stop. The moment they say that, stop. Stop and look at the patient's ID wristband. What is their name? Of course, you did that before giving them their medication. But when you're giving the medication, before starting, anytime we give the medication, before starting, we always ask the patient to state their name and their date of birth. And we compare that with the wristband, which has their name and date of birth. And then we compare that with the medication administration record. The paper where the medications are written, it has a sticker. And the sticker has their name, the date of birth, and even their ID, their admission number. But because they may not know the admission number, their full names and the date of birth will tell you whether this is the same patient you're dealing with. So if they say that and you pause, you've already asked their name and it is correct. Looking at their medication administration record, you can counter check what I'm giving them in the vial, this medication I've drawn, just counter checking. And what is written in the card, am I giving the right thing? And if you've confirmed that it is correct, go ahead and give it to them. Tell them you're going to look into it. But just reassure them, sometimes the medication could be the same medication, but the one that the manufacturer has given for the day maybe is different in color. It is possible. However, don't make it look like you're panicking because the patient may start thinking they've been given a wrong medication. And yet, for sure, going back to check, it's still the same medication. Everything is the same, only that what has come in today, maybe there was a different brand that has come, but the same medication. Nothing has changed. So it is just good that when they speak, just pay attention. They may say, how come you're giving me 4 pills this morning, and yet I've been getting 2, a red one and a white one? Truly, it may be that you're making a medication error. So check and confirm. Pay attention to what they're saying and respond. When they say that, just go back to the medication administration record. Be safe. Ensure that what you're giving them truly is what they're supposed to give. And after they say that, if they said, yesterday I got this and that, go back and confirm, maybe from the records, what did that nurse give that was only 2, a red one and a white one? Yet in the morning at such a time, they should have only 4 and they're all white. So when you look at that, you can be able to pick out something, whether it is a medication error or not. Patient safety. So just to have a clue of how effective communication is also a point of etiquette that should be upheld. Now, what about with the other colleagues or the healthcare workers? Now, if a colleague, for instance, has seen a call button go off, the patient is asking for help, that is not the patient assigned to her. However, in nursing, we always say it doesn't matter if it is your patient or not. When you see a call button, anyone should be able to go in, find out what the patient has, then relay to the correct person. For all you know, they may want maybe ice cream instead of sherbet. That is something that is escalated to the kitchen. To let the dietary department know, could you please give patient so-and-so, they're requesting for sherbet instead of ice cream. So anyone can go into the room, whether it is the cleaners or what have you. When they see the light, no one should pass it. Go in and find out, then direct the information to the correct persons. Now, your colleague has gone into the room to your patient and they've heard what the patient wants. So when they come to you as a nurse and tells you what the patient has said they want, it is upon you to respond appropriately. Listen to what they're saying and respond appropriately. Oh, thank you for answering the call button on my behalf. I'm going to get to it right away. I'm going to look into it right away. I will see them in a minute. You have responded appropriately. Instead of ignoring or remaining silent as they are telling you, they won't know whether you heard them or you are ignoring. So it is always good to listen and also respond appropriately. Now, let me go to the third point of etiquette, and this has to do with respect and courtesy. Like I've just said, there is a connection between the effective communication and respect and courtesy. Now, respect and courtesy may have to do with the greetings. Now, this is where the please, could you please, pardon me, excuse me, thank you, good morning, good afternoon, good evening, have a good night come in. It is about how you relate with the patient, how you relate with the families of the patient, and even other healthcare workers. So the nurse is expected to use to greet others using their titles and in a formal manner. So matters of, for instance, going to a patient's room and saying, "Hi, how are you?" It is not good etiquette. We're required to use the terms based on the time of the day. Good morning, Mr. So-and-so. How are you? How was your night? Did you have a good night? You look much brighter this morning. How are you feeling? Are you feeling much better? Oh, okay. I'd like to open your curtains. Is it okay with you? If they say no, that's fine. I'll simply turn on the light. Respectful communication, using formal terms, asking for permission before doing anything. If you spend a whole shift with the nurse, you'll be surprised how many times we have to ask. For instance, like I've just talked of the medication administration record, asking them to state their name as you look at their wristband and you compare with what is written. That is done every time medication is given. So a patient may look and think, I just told you my name. What is it that you keep asking me all the time? This is to ensure that you have the correct patient and to avoid medication errors. What if the patient told me the first time at 7 a.m., then I went in to give them the 10 a.m. Treatment, then I went in at noon. Then it so happens that that room, the oxygen portal is faulty and has to be fixed. It just has to be fixed. So maybe the patient is moved to the next room. From room 4, they're moved to room 2, which is still vacant, so that this can be fixed, and then the patient will be returned. We avoid such things during the stay of the patient, but if it is something that has to be done, and it has to be done, the patient will be removed. Not everything in the room. So when they're being cared for in room 2, and you who thinks that knowing the patient room 2, it's time for their 10 a.m. What if they were moved? The engineers have finished their work, and then the patient in room 2 remains there and their things are moved there. So this room is cleaned and waiting for admission. So a new admission has now come to room 4. Now you go in with your 2 p.m. medication and you've picked the form. Peradventure, the patient that has come is called Mr. John Ignatius. And your patient that was moved to room 2 is Mr. John Ingram. Look at the similarity of the names, even though they are not the same. It is very easy to think, was it not Mr. John? Both of them are Mr. John. It was an Ignatius, Ingram. Well, you have 6, 7, 8 patients. So I just know it is room number 4. They're both John. They're both Caucasians or Asians or Africans. They're both males. So it's the same patient. And you end up giving the wrong medication to the same patient. That is why at all times we do the checks, the checks that have the 3 checks. Then we also ask for permission, because sometimes you may say, I want to do 1, 2, 3. And then the patient may think and say, but I don't have a wound. That will raise an alarm. You're with the wrong patient. And the patients turn over. Maybe you had one patient who came to the hospital. They only stayed for 1 night, they were discharged. Another one was there for 2 nights, they were discharged. This one has been here for 5 days. So you see, there's a high turnover of the patients, and it is very easy to confuse. So matters of being formal, being respectful, asking for permission, that permission you're asking could raise a red flag and an error could be caught before it happens. So asking for permission, being formal. Now, in matters, greetings. Again, it's going to tie out to our next point. In matters greetings, there are some cultures that don't mind hi, saying hi. Hi, Mr. John Ingram, how are you this morning? That is fine for them. Others, for instance, Africa, hi is very disrespectful. Hi to who? They want to hear good morning. They want to hear good afternoon. Some of them, good morning, Mr. John, is okay. But another one, you don't call them by their first names. They'll expect you to say, "Good morning, Mr. Ingram." So that goes with why it is important to just keep it formal. "Good morning, Mr. John Ingram." So it is upon them to say, "It's okay. You can call me Joe. You can call me Mr. Joe." So even if they say, "Call me Joe," you don't go in to say, "Good morning, Joe." You don't go in to say, "Joe, how are you?" You'll still have to use the formal part, "Good morning, Joe," because they prefer to be called Joe instead of maybe John. All right. So I'm hoping you're understanding this part of using their titles. Are they doctor? Are they professor? Are they engineer? So someone may say, "You don't have to call me John Ingram. You can just call me engineer." So you go in and say, "Good morning, engineer. How are you? Good evening, engineer. Have a good day, engineer. I'm leaving. My shift is over." You are communicating formally with respect and courtesy. Then another part of respect and courtesy, also with the colleagues. This is not just the patients and their families, but the colleagues too. You greet each other because you're going to work together for the next few hours. You want collaboration during the work time. So there's the greeting, there's the "Thank you. Please could you pass me that file? Are you done with Mr. So-and-so's file? Please could I have it? Thank you. Oh, I'm sorry, I forgot. I'm really sorry. Pardon me. That is etiquette. That should be carried on at the workplace. And that is what you, the nursing student, will be taught. Good, good, good. So, apart from respect and courtesy, we have matters. Let's look at the next one. We've talked again about the first one, which is adherence to the ethics and professional standards. We've looked at being an effective communicator. I've said it is tied up to also being respectful and courteous. Then fourthly, let's look at cultural sensitivity. These three, effective communication, respect and courtesy, and cultural sensitivity, are closely related. Now, cultural sensitivity, I won't go so much deeper because I've been talking about it in our previous episodes. Remember when I mentioned the Orthodox Jews, I talked about maybe Seventh-day Adventists, the Catholics, the Hindus, the Islam. That is cultural sensitivity. It's more the religious part or their beliefs, but also culture is ingrained in it. Now, when you talk of cultural sensitivity, this patient or their family, when they've come in and they're admitted, there's the information they give. Apart from on their biodata, there's the name, the full names, you have their age, we have whether they're male or female, their gender, then what is their religion, their ethnic background. I did mention that all this information is gathered in order to care for the patient. Now, as a nurse or nursing student, you're required to respect that culture that they have come with. Be culturally sensitive. That is why you're gathering this information. It is not being collected just so that you will know whether they are Africans or not, or for matters biasness. There's a reason why this information is collected. When you have the patient and you have this information, we try as much as possible to tailor their care towards their culture, being culturally sensitive, to base their care on their culture. Now, we do this as long as it does not interfere with the treatment. I'll give you an example. The patient has a belief. For instance, they have a small shrine in their home. Now, they cannot carry that shrine, like our Asian brothers, carry that shrine and bring it to their hospital room. It may interfere with their care. But they can call their own spiritual leaders and their own religious people to come and pray for them. during their stay in hospital. So you are able to at least give them the care and ensure that you've created time for them to have their own religious practices. Now, if they have mentioned that the people from their temple, if they're Asians, are coming in at 10 a.m. for their prayers, whatever care or medication or treatment you have for them should be done before these people come. Of course, you're following the time in the medication administration record, so that you don't go and take medication that is due for 12 p.m. and you start giving them before 10 a.m. just so that the prayers does not interfere with your program. However, whatever other care, you prioritize them. At least they're all cleaned up, the room is neat, you ensure they've taken their breakfast, their early medications are given. Now, when these religious persons come in, they are not interfering with your treatment because at least you've sorted that out, but also you are not interfering with their prayers or their beliefs or whatever it is that they want to do in matters religion. Other than that, being culturally sensitive, we have maybe the people from the Middle East areas. For them, when you're communicating with them, eye contact is considered disrespectful and even a sign of aggression. So when you're communicating with them, you don't stare into their eyes. That one, you're being disrespectful to them. You're coming out forthright. You're being aggressive. So you may wonder, then how do I look at them? There's a glancing. As you are reading something, you can be glancing just to ensure that what you're telling them, they're getting it. Or if they look like they're lost, you're able to clarify. So you talk to them, glance at them, and look away, so that you are not giving them that eye contact and being culturally insensitive. However, you now have a Caucasian, maybe from Europe, North America, Canada, Australia. For them, if you do what you're doing to the Middle Easterns, you are being dishonest, or you're not being truthful. There's something that, comes in. They'll start feeling like this information, there's something fishy about it. So with this group of people, the Caucasians, they require you to maintain eye contact. So you're being culturally sensitive. For the Caucasians, you're giving them eye contact. That way you're able to communicate. They're seeing that truly you're being honest, you're being truthful, they will be able to relate with you better. But when you get to your Middle Eastern patient and their families, avoid direct eye contact because that is being aggressive and also being rebellious. So you try and glance aside as you glance at them as you look aside. They'll be able to receive whatever care you're giving to them. So you're seeing matters, cultural sensitivity, and how it is important in terms of their belief, how to give them time, so that when they tell you the Catholic is saying, I need my priest to come and sprinkle holy water, you don't start saying, well, I'm Pentecostal, those things, we don't believe in them. We don't allow such kind of things here. I can pray for you, I can lay hands on you. You do not do that. Give them room to practice their own, to practice their own belief and what they want. If they say they want the Catholic priest to come and sprinkle holy water, create the room for them. What time is their treatment? When do they want it done? So they say the priest is coming after lunch. Ensure they have their lunch on time. Coordinate with the dietary department to bring their lunch. Have them use the restroom and they're ready for the priest. When the priest is done and they're gone, continue with your care. Like I promised, we are going to look at matters spirituality in a separate episode so that I may explain, because nursing is a ministry. Then I will show how to incorporate the spirituality in all this. But for now, what the nursing students should expect and what the nurses are required to do is to respect the beliefs of the patient, and that is being culturally sensitive. Another issue about cultural sensitivity, I've mentioned, it ties out to courtesy and respect and communication, just how we greet, like how some would don't mind being greeted hi or goodbye. Some would want you to say goodbye, Mr. So and so, or goodbye, Mrs. So and so. My shift is over. I'm handing you over to the next team, ABCD. However, what would be termed poor etiquette is saying, for instance, laters, bye, I've gone, I'll see you later. That is informal. That is not allowed in the nursing profession. It is overstepping the boundary of professional nursing etiquette. All right, ladies and gentlemen, let's review again. Adherence to ethics and professional standards, respect and courtesy, effective communication, professional appearance, and now we're going to let's look at social media etiquette. Now, in matters social media etiquette, we all know what social media is all about. Now, the nurse is not allowed to, for instance, take photos of the patient and share it on social media, or do selfies with the patient, whether it is during the admission or during their care, or now they are discharged and they're all dressed up, ready to go home. You are not allowed as a nurse or as a nursing student to take photos with them or even selfies and then take it to social media. Now, this goes beyond photos, even writing anything on social media. Mr. So-and-so, the member of parliament for what have you. Oh, he's now better. We've discharged him. He's looking good. Praise God. That is not allowed in the nursing profession. This matter is so serious that it can cost you as a nursing student to be kicked out of nursing school, you as a nurse to have your license even revoked, or even disciplinary measures where you can be suspended or expelled. It is something that is not legally allowed. It is very illegal. So I've talked about the first part, which was adherence to the ethics and etiquettes, ethics and professional standard. Now, this that you're talking about is tied very closely to privacy and confidentiality. You as a nurse in the nursing profession, you should keep your lips sealed. It does not matter who has come, whether it is the president's wife or children, even if it's the president's 1-year-old child. That child may be 1 year old, but they belong to a family. You are not supposed to say anything. Even going home and telling your family members, your children, your spouse, guess who came to hospital today? The member of parliament. Do you know the member of parliament of what county or state? Their last born child, 1-year-old child, was admitted today. They came in with asthma. You should not mention that they are in your facility or that you nurse them. That is privacy and confidentiality. And the etiquette you're supposed to uphold here, the professional standard, is the social media etiquette. Keep it out. Maintain their privacy. Maintain their confidentiality. It is something very serious. For you to know how serious it is, there was a case about 12 years ago in the United Kingdom, Prince William and Kate Middleton, when they had their first, when Kate Middleton, or when they were expecting their first child, there was a radio station from Australia that pranked the nurses in the hospital. They called from the radio station, a gentleman and a lady at the radio station, the gentleman pretending to be Prince Charles, and the lady pretending to be the Queen. And they changed their voice and called the hospital in London where Kate Middleton had been admitted with I believe it was something like vomiting, nausea, vomiting, and all. So when they called and they switched their voice, then there's a first nurse that picked the call and spoke to the radio station. They're thinking they're speaking to Prince Charles, who is asking how the Kate Middleton is doing. That nurse who picked transferred the call to the main nurse taking care of Kate Middleton directly. And she ended up giving full information about Kate's condition in hospital. And after that, the newspapers picked, it was in the media, the following day, or maybe as soon as immediately, about this nurse who had given information to a radio hoax or radio presenters who had pranked her. This nurse felt so bad that after 2 or 3 days, she committed suicide. You may now understand, because she understood from nursing school on matters confidentiality and privacy. Now you can imagine how she felt, how that this is the Queen's family and she's giving the information to a radio station. Of course, it could be legally binding. She could end up being jailed for I don't know how many years. I don't know what the consequences are in UK. But that is how serious this matters confidentiality and privacy is. That you should not reveal such information. It is part of etiquette. So when you're in school as a nursing student, don't just take this as, okay, yeah, we're supposed to say good morning. Just pay attention. Because many of these things could be so legally binding. For you to see a nurse committing suicide, it meant she knew the consequence was grave. Now, outside that very hospital in London, the news stations had lined up. You know how they focus the cameras to the door of the hospital. Anyone coming in, anyone going out, the camera is waiting. For days, they camped there in the night hours, during the day they are camping. So you can imagine they are waiting to just get the slightest of information. However, you as a nurse, you've already given information to a radio station. Everyone, well, just about everyone felt sorry for the nurse because she was being genuine. You know, when you get the call, the person is sounding like the Queen and the Prince. So she gave the information in good faith. But that is a lesson learned. Truly, we all learned something out of that. Because one, imagine this is not the prince or the princess, and somebody comes in well-dressed, they're carrying a bouquet of flowers, a box of chocolates, and they come to the nurses station and they greet you pleasantly. How are you ladies doing? Greeting the nurses. We all respond. You all look bright and cheerful. I've come in to see my wife in room number 2, Mrs. So-and-so. How is she? Immediately, because of the way the person has presented themselves, it is possible that you'll immediately turn to the nurse responsible for the patient, and that nurse will stand and go to the family member and start giving information. She was in pain during the night, but we gave her pain medication. Right now, she's okay. She slept at 5 a.m., but she's been okay. And then the patient will go ahead and the family will ask again, so has she been eating, any new medication that the doctor has given? You end up giving all the information. What the doctor said, the diagnosis, you know how the patient is. That very person can end up passing, use the other elevator, and disappear. And the following day, the social media has picked it up. You'll see it in the vlogs, you'll see it in the Facebook and Instagram, even the television. And who gave the information? You, the innocent nurse who was being courteous, who was being respectful, who was observing all the etiquettes, except you are not careful in matters adhering to the professional standards and maintaining the confidentiality and privacy of the patient. We learned a lot, and it is something that should be taken seriously. So social media etiquette is very important. Another social media etiquette is do not follow the patient, current patient, or former patient to the social media page. It is not allowed. It is not a good etiquette. That you have this patient, you've cared for them. After finishing, maybe you go to the DM. It may not be you following them, but when you check your DM or when you check your friend request, you find that they are requesting you to follow them back. You are not allowed to follow them back. You are not allowed to follow them back. If they need to talk to you or see you, they should find you at the workplace. Come and see you there and communicate whatever matter they need to communicate. But matters adding or following or, interacting with your patients during their stay or after their stay, it's not allowed because it is overstepping that professional boundary. That is part of social media etiquette. Now, ladies and gentlemen, I have touched on matters etiquette. I don't know if I've touched all 6. Let's see. Let's recount. The first one, adherence to the ethics and professional standards. We talked about ethics in our last episode, and the professional standards have also explained what they're all about. Then secondly, we've talked about being an effective communicator, how you should communicate clear and concisely, in a clear manner and concisely, avoid informal languages, slangs, and all. Then the third one is about professional appearance, how you should present yourself from the crown of your head to the sole of your foot and keeping it neat. Then fourth, cultural sensitivity, being sensitive to the cultural preferences of the patient and incorporating whatever their cultures or their beliefs are into the care that they are getting. Then fifth, we've also looked at courtesy and respect, using those good words. Please, excuse me, I'm sorry, pardon me, could you please, may I, thank you, all this, and then the greeting should be formal, using their titles, Then we've also looked at the social media etiquette, and I've just explained that we should avoid following or being followed by the people that we care for in the hospital, whether currently or after their care. Now, ladies and gentlemen, I want to just add one more, and that is also the body language. Being sensitive to your body language whenever you're communicating and how it is perceived by others. Remember, we said etiquette is about behavior, the attitudes and the values that guide you as a nurse, how you relate to the patient, to their families, and to your colleagues. So for instance, you have this behavior or this mannerism. Maybe you pout your cheeks, According to you, you're maybe processing something in your mind. But if you are by the bedside, the patient's bedside, and maybe the doctors are there, the physical therapist, the occupational therapist, and you're doing the doctor's rounds. So you get to the bedside and you are busy. The rest of your colleagues and the patient, when they see you, it's going out as if you're not paying attention. You're being rude. Because you should be more formal, you should be attentive. You should, if it's a Caucasian, be giving eye contact. Exude that look of caring, being compassionate, being empathetic. That's what you should be exuding. So you have to be careful about your body language and what you're communicating through it. This may be a patient who probably the physicians are busy looking and coming to a conclusion that their arm needs to be amputated. So if they are discussing matters amputation of a limb, something so serious as that, they are losing their arm, and you're busy pouting your cheeks, it's not exuding empathy. You're coming off like you don't care. Like it doesn't matter. It doesn't concern you. They're losing their arms, so what? That should not happen. Now, I have stretched up this video, but I have to refer this topic to the Bible. I'll try and summarize. Ever heard of a story in the Bible, in the book of 1 Samuel in chapter 25? We have David once again. We have a lady called Abigail and her husband Nabal. So here we have Abigail and the husband Nabal, and here we have David. At that time, David was moving around with a group of men. They're called the mighty men of David, who are more or less like warriors. But they were running away from Saul because Saul would pursue David to kill him. He would escape, move on to a wilderness. Saul would catch up, then he escapes, moves on to a desert. So while he was on the run with these mighty men of David, who are about 400, 600 in number, there's a time they were at the wilderness. And then while they're at the wilderness, they were next to some shepherds, and these shepherds were taking care of so many goats and sheep of a wealthy man called Nabal. Now, Nabal was so wealthy, he had about 4,000 sheep, 1,000 goats. He was so wealthy. Now, when he's in Carmel with his wife and all, a time came for the sheep to be sheared. Now, David heard that the sheep are being sheared in Carmel, and they were Nabal's sheep. So during this festive season, he calls 10 of his young men, and he gives them instruction. Go to Nabal. Tell him, when your men were in the wilderness, we cared for them, we watched over them, nothing of theirs was missing, we were good to them. Now, I'm just requesting you, if you could please find something to give me in this festive season for me and my men. Give us something, whatever you can find, give it to us, please. David was requesting in a courteous manner, in a respectful manner. He even told the young men to greet Nabal in the name of David. Tell him, long life to you, Nabal. Good health to you and your household. Good health to all that is yours. Greet him respectfully. Remember, we're talking about etiquette. So he's giving these greetings in a respectful manner, in a courteous way. Go and greet Nabal in my name like this. He's instructing them. So when the young men got to Nabal or his household, they gave the greetings as told. They made their request as told, and they waited. What did Nabal do? This man was a choleric. He was surly, he was mean, he was ill-tempered. So how he responds, he said, who is this David? Who is this son of Jesse? Nowadays there are so many servants who have broken away from their masters. Why should I give my bread and my water and the meat that I have slaughtered for my shearers to a man from I don't know who, coming from I don't know where? He was being very mean and in a very ill-tempered way. He was a wicked man. When he responded like this, those men went back to David and gave that information. David told his 400 men, strap your swords, let's go. And he also strapped his sword and went for Nabal. 200 men remained with their supplies. While he was on his way, a servant broke from Nabal and went to Abigail. Now, Abigail was an intelligent woman. She was a beautiful woman. She knew all about David. She knew that he was a king to be. She had more or less studied what David was all about because of the way she had spoken when she met David later. So when the servant went to Abigail, he told her, there are some men who came to our master Nabal, and this is what they said, these are the greetings they brought from David, and they had made a request, but our master, who is, who no one can talk to, no one can talk to him, is a wicked man. This is how he responded. Now listen to what the servant is saying. He is a wicked man, no one can talk to him. What have we talked about here? About effective communication, about courtesy, about respect. All these things are matters etiquette that Nabal did not have. So the servant has told Abigail. Abigail, being the wise woman that she was, immediately got up, because the servant says, please do something, because as it looks, doom is hanging over the entire household. Abigail got up and got cakes 200 cakes, 100 cakes of pressed, 200 cakes of pressed figs, some with raisins, wineskins, sears of roasted grain. And she put them on the donkeys and told the servants, "Get going, I'm following you." When she got to David, she went on her face on the ground. She lay on the ground on her face, went to David's feet and was pleading. She called David, "Lord, my Lord, please listen out. Pay attention, please, to your servant." She called herself servant and referring to David as Lord. Pay attention to what your servant has to say, my Lord. Do not mind this man, Nabal. He's just like his name. His name means fool. Folly follows him. Don't pay him any mind. But as for you, don't allow yourself to get into your hands into bloodshed. Don't avenge yourself, because I know that God Almighty, He's going to give your enemies, He's going to deal with your enemies. He's giving you the dynasty. And when He's done all these good things for you, please remember your servant. Abigail was respecting David, calling him Lord, going down on her face, being culturally sensitive, giving David that honor that David himself truly knew. I have been honored. Here I have been respected. Courtesy is at work. This woman has known how to approach me more or less like a king that David wasn't yet, but by anointing he was. But the way she presented that, the way she carried herself with all that etiquette, saved the entire household, because David had decided, he had just spoken and he said, the way we have been so good to this man, nothing of his was missing. The servant had even mentioned and said, day and night, these men of David were surrounding them. They were like a wall around them. Nothing was missing. It was more or less like they protected them. Remember, these are the mighty men of David. They were like warriors. They could have bullied them. They're in the wilderness. They're with shepherds. These men have all these thousands of sheep and goats. They could have been taking and slaughtering and eating and there's nothing that the shepherds could do. But they protected them and they did not touch any of their things. Now the servant is relaying this to Abigail, that these people are so good to us. But our master is in his wickedness. This is how he has responded to David. So he knew that the way we had studied these people, doom is coming. And truly David had decided he was going to slaughter all the men in that household. So when Abigail presented herself to David like this, David felt respected and honored, and he told Abigail, thanks be to God who has sent you to meet me. Because before daybreak, all the men in your household would have been gone. But as for you, go in peace. I have heard your request. And that is how Abigail went back, and David went with the supplies that he had accepted from Abigail. Towards the end, as time went by, when Abigail got home, she found Nabal drunk, in high spirits. She didn't say anything. The following day, when she brought the news to Nabal, his heart failed him. He turned into a stone, some form of a stone. I always assume it was more or less like he went into heart attack. And after 10 days, God killed him. What I asked myself was this: if matters etiquette can make God himself deal with the enemies of David, because David said he held him in contempt. Who is this David? Who is this son of Jesse? Nowadays, servants. He's calling David a servant, somebody that has been anointed to be king already. So much as Nabal did not know about David, the fact that he did not offer any respect, he did not even listen, paying attention and responding appropriately, we have discussed that. All these violations of etiquette cost him his life. No one assassinated him. No one killed him. He wasn't murdered. God himself dealt with him. That is why it is so important, even as nurses, nursing is a ministry. It is so important to uphold these etiquettes. That is why we are taught in school That when you are there and being told about being courteous, you don't know whom you're dealing with. It may be that you may not be fired from work, you may not lose your job. Worst case scenario, you may not lose your license. But what if you're dealing with a David in hospital? What if this person you're caring for who looks normal is that somebody anointed? If God could do this for David and kill a man for holding him in contempt, refusing to give him supplies, refusing to give David supplies cost Nabal his life. Why? He held him in contempt. He violated all the etiquette principles. Just listening to the servants, responding to them appropriately, being courteous, even the words he used, it would have even just been better for him to say no. Not today. Maybe David would have thought maybe he has sold some or something. But everything he was saying, the way he was saying it, who is this? Why should I? Nowadays servants are breaking away from their masters. Those words that they used, that is what you're talking about, matters communication. Be careful as a nurse. Be careful as a nursing student. Take this matters ethics and etiquette very, very seriously. I've given you an example of a nurse that committed suicide. She was innocent. She was being courteous, but she violated confidentiality and privacy. Why? She didn't go further to confirm, am I really talking to the Queen and Prince Charles? Whom am I really talking to? And it can happen to you on the floor. Like I've given the example. Somebody's coming looking like a family member. Instead of going to the file and finding out who was indicated as the next of kin, if not available, how about number 2? If it is written so-and-so, ask them to identify that they are truly Mr. or Mrs. so-and-so before you can give the information. Find out from the file, did the patient put a restriction that they only want the information shared with their daughter, their third-born daughter? That is the person to be given information. Find out before politely, with courtesy and respect and with your concise, clear information, you give the information and then end up violating another etiquette principle there. So ladies and gentlemen, it's been a wonderful episode for us. I do hope we've understood the importance of etiquette. There are people committing suicide because of these issues. There's somebody in the Bible who was killed by God himself for being contemptuous toward another, a king to be, and that was David, just by the things he was saying, just by his mannerism, how he responded to others. We've seen David himself has more etiquette than Nabal. David is sending greetings. Greet him in my name. Tell him, long live. And yet he's not a king. He's a wicked man. He is a man who is ill-tempered. But David understood etiquette. And he's sending his 10 young men. Tell him, long life to you. Good health to your household and to all that is yours. Etiquette, greetings, formally. David understood it. Nabal did not. Abigail understood it, and by the way, in the very end, after Nabal died, who married Abigail? David. He sent some people to go and tell Abigail he was interested in her if she could go and be his wife, simply because she had etiquette. She knew how to present herself. She knew how to go before David, how to plead for her husband, even though he was a wicked man. But she knew that lives were at stake. She could have gone there and said, leave that man alone. But she got gifts. She presented. There's a way she spoke to David. And that saved an entire household that could have been wiped away because of one man's wickedness and being ill-tempered, being surly. I hope you've understood, and I hope you'll take this serious. That is what you should expect. You who has not joined the nursing school, that you will be taught and be prepared for the workplace. And you who is in nursing school, whatever you've been taught, if at all you've covered this, please take it seriously. Don't just focus on it because it is exam time. When you go to the ward, you are rude, you don't greet formally, You will start following patients on social media. You do your own thing. Do not do that. You will be violating these principles and it could cost you dearly. It could cost your license and you would have wasted all your nursing school years. So, once again, my name is Ludia Osita. Thank you for sticking in with me. Thank you for taking these notes down. I hope you've learned something. Please go ahead and apply it. Thank you, and once again, this is the Nursing Ministry channel. I'll see you next week. Goodbye.